Thank you so much, John. Our next speaker is Sally Allocca. Her title is The Role of Community Programs, PEER Incorporated. Sally is Senior Pastor of East Lake United Methodist Church in Birmingham, Alabama. Welcome to the podium, Sally.
Good morning. I greatly appreciate the opportunity to be here and to share with you today about the program we have to how a church kitchen can partner with a nonprofit organization to form a viable food system. Wanted to start out with a short video that was produced by two students from the University of Alabama at Birmingham for one of their classes about the church and the nonprofit PEER.
And now it seems like everything is more focused on fast food. Kids don't get out and walk and exercise, and some of the old traditional values I was hoping to instill in my kids that I learned when I was a child don't really seem to exist anymore.
Glad you're over there, Kira. Doing good. There we go.
When I was younger, growing up, I remember it being more like home-based, homemade, family dinners, get-togethers. And now it seems like everything is more focused on fast food. Kids don't get out and walk and exercise, and some of the old traditional values I was hoping to instill in my kids that I learned when I was a child don't really seem to exist anymore.
The church has been here 125 years this year, and it has always seen itself as a community center. We have been a polling place, the neighborhood association meets here, the Merchants Association meets here. We had a daycare that was here for 35 years, so most of the people in the community, even if they attend other churches, see this as a central community resource in the neighborhood.
I'm Jay Thornley, and I've actually been in this community since, or involved in some way in this community since 51.
I've been here about 4 years, and I was born, grew up in Birmingham, went to school here before I went to the University of Alabama, and love Birmingham.
I was born here in Birmingham, but I was raised in Boston, and when I got in my 30s, I decided to move back to Birmingham to give my kids a taste of Southern living and be a little bit close to family members. People will tell me I'm small, and I would always say, yeah, by Birmingham standards, but not the rest of the world. You know, this is not acceptable, but people look around and they see that the other people are getting big, their kids are big, my parents are big, so it's like, I'm not big, I'm small. You know, it's like acceptable, and it's not.
People who are food insecure, when they are able to buy foods, will buy the most calorie-dense foods and not often the most nutritionally dense foods. And so they may become obese. That may be actually a side effect, ironically, of people who don't have access to enough food.
First, we identified Birmingham's food deserts specifically, geographically, and what we learned was that essentially all of Birmingham is a food desert.
Food deserts are rural towns and urban neighborhoods that have low access to fresh, healthy, and affordable food. We see it typically, it's associated with high poverty neighborhoods. There oftentimes are a lot of urban blight in those communities where houses are not occupied, where they might be boarded up, or there might be lots of broken windows.
Poverty and food insecurity really go hand in hand. If you don't have adequate income, food is often one of the first things to go. You're going to pay your rent and pay your electricity. You're probably going to put gas in your car or buy a bus pass so you can get to work. I've just seen it over and over again, is that they'll try to make do without eating, or without eating a healthy, balanced diet. Nearly 900,000 Alabamians live below the federal poverty line. That's about 1 in 5 of our neighbors.
I live, about 2.5, 3 blocks from here, and walk down, but Jay or Charles give me a ride home a lot of times. It's kind of an uphill. I coast down, but it's a little harder to get home. So, and I sold all my vehicles, and I ride the bus a lot. I get a lot of stuff from the village market. I get their sale items. Then I get everything else at Walmart. And the bus stops right at Walmart. And like I say, I figure out exactly how much will fit into my backpack, and that's what I buy.
We work with corner store owners to identify their customer wants and needs, the market demand that's there. The amount of product that a corner store owner can move or purchase is probably at most $100 a month is what we're finding. So a traditional distributor is not going to find that as a viable business opportunity. Therefore, Rev began to see a tremendous economic development opportunity in helping corner store owners source that product and getting it to them by developing a local distribution system.
I'm the health coordinator here at PEER Inc. It stands for Promoting Empowerment and Enrichment Resources. It's a nonprofit organization that was started in 2005 in response to food access in Eastlake. Eastlake was a food desert before the nonprofit started a farmers market here in 2010.
It has been a challenge to do a farmer's market in a low-income neighborhood because a lot of the markets are trendy for folks that are used to buying higher-end items. But our goal was to provide access to people who might not be able to get it anyway.
I actually fell in a rut when I came here. My work hours and schedule and just getting lazy. I used to buy canned goods and supplement canned goods, you know, instead of taking the time to actually prepare a meal, and I ended up putting on about 30 pounds. And luckily they started the farmers market here at the church, and I started going across. In 1 month, I ended up losing about 25 pounds just from cutting out all of the sodium, all of the preservatives.
The farmers market brings in so much more, and it's so much fresher.
I see seniors here that live in a community. They're just walking down the street with their little baskets, and they love to get the greens and the tomatoes and the vegetables and everything, and it's like a community bond.
Several years ago, we started a diner. We have a health department approved kitchen, so it's open to the public, and the librarians come, and the postal workers come, and the church members come, and the community members come, and it's an affordable meal using the fresh produce we get from the farmers at the farmers market. And it's a wonderful opportunity for people across the board to have access to great hearty food, but also to have access to community.
The food's not only great, but being able to sit down with other human beings. If I just was like I was just staying at home and not seeing many folks.
Yeah, the food program here at the church has brought a lot of people here that would not have come here, and has brought the community closer together.
I had a girl once, and she gets $1,000 a month in food stamps. And just because she didn't have the knowledge on what to really buy for her family of that size, that she would still need assistance and ask for help 2 weeks after she got her food stamps. And I said, what in the world happened? And she said, well, you don't get food stamps? And I said, no, I don't. She said, oh, I thought you did, because y'all always eat good over there. And I'm like, I said, because I have to budget and I plan, and the meals I make aren't really expensive. It's just knowing what to do and having the tools to do it with.
I mean, some people just don't even know what the stuff is that we're trying to sell, and so they're unfamiliar with the product, and they're also unfamiliar with ways to prepare it. So we're trying to tackle both of those problems in one with the mobile market truck. Every week through the market, we deliver 150 boxes of fresh produce to seniors in 2 of the independent living facilities here in Eastlake, And we also do a lot of programming during the market. So we provide cooking demonstrations, health screenings, a kids activity booth, and gardening activities every Saturday.
Particularly for young children, it's an issue because their brains are developing. Childhood food insecurity is linked to poor lifetime health outcomes. It can impact a child's intellectual development and their ability to succeed in school, which then means that's going to impact their earning capacity as an adult. And so it is this vicious cycle that if kids don't have the good energy that they need to grow and be healthy, then they're far more likely to be poor adults.
Studies have shown it, but I know every day we feel it. What you eat really affects how you feel.
This is not an issue for the faint of heart. This is not an issue just for the people who have bleeding hearts. This is not something that any one discipline can tackle. Food insecurity has got to be tackled and addressed in a multifaceted, multidisciplinary, collaborative way.
Our interest in food is because it brings us all together in a way that nothing else quite does.
Like, I want people that have recipes. I guard my recipes. I want people that, you know, oh no, this is grandma's secret sweet potato pie. I want people to take pride in it.
Everybody needs fresh fruits and vegetables.
Everybody eats.
Yes, everybody eats.
Everybody eats.
Southeast Lake is an interesting place in Birmingham. I have served there at the church for the last 22 years and have been the executive director of the nonprofit for the last 10. It has seen a demographic change that is not very atypical, but a dramatic shift in the last 15 or so years. You can see some of the information there in front of you, particular to your interests. They're about 10% over 65. You can see that it is predominantly African American. In this next slide, you'll see that about 28% live alone. The median income is $23,000. About a third receive SNAP benefits. We have about 25% that live below the poverty level. You heard a little bit about the church. The motto for the church is "In the Neighborhood for Good." That is to signify both the tenure and our intent to do good while we are in the neighborhood. Once the daycare closed, we made the decision to keep the health department approved kitchen under certification because we felt that food was very basic, as the video says, everybody eats, so that we would be able to use that in both ministry and community programs. That is how we created the downstairs diner. You got to see a little bit about that. We have healthier, heartier meals for the diner. They're served 5 days a week. They're available to people in the community at a modest cost. We find many caregivers will come and pick up food for the people they're caring for. I know that when my mother was alive and suffering from a lot of health issues, I told her if she would eat one meal that Juanita cooked in the kitchen a day, I didn't care what she ate the rest of the time, because I know she would be getting a full meal and good food. And we try to provide things, as many of the speakers have said, that are healthy and tasty, familiar type foods that people are interested in eating. 10 years ago, in an effort to more effectively reach the community, I started Peer Incorporated, which stands for Promoting Empowerment and Enrichment Resources. Nobody remembers what that name means, including my board, but the intent was to talk about working with people in the community, working together to make a difference, particularly on food access. Our flagship program is the East Lake Farmers Market. It runs on Saturdays, May to October. It is a pretty standard market. It's producer only, meaning the farmers sell only what they grow. We have live music, we have baked goods, we have local artists, we offer health screenings, kids activities, all kind of wonderful programs at the market. One of the favorite programs that we offer is the Senior Market Basket programs. We purchase from the farmers in bulk the prior week in order to deliver 150 boxes each week to low-income seniors in 2 neighboring HUD housing senior facility centers, free of charge to them. We get the money through grant monies. It is a wonderful volunteer opportunity. It is family friendly. People will show up first thing in the morning. They'll get the food from the farmers. They'll pack the boxes, and then they deliver it to the senior's door, which means they're not only getting fresh produce to the people who are most likely to want it, know how to cook it, and eat it, but they're providing that needed social interaction with the individuals as well. If you would like to learn more about this program, there is an article published in the Journal of Hunger and Environmental Nutrition about how that program works. We have 2 new programs at the farmers market that we're really excited about to provide more accessibility to those in need. One is a double bucks program. For people who use their SNAP benefits, their EBT card, we will double their dollar every market day up to $20. You put $4 on your card, you get $4. We have Monopoly money that we give out that people use at our market. They can do that once a market. Every single market day, they can get that. We have seen more consistent customers this year using their EBT cards, and some of them are even purchasing market baskets from us. We have a CSA type program off of the market. So I'm thankful that we are kind of, at least in our part of town, retraining folks about farmers market. People are used to that, but a lot of our markets are trendy, and so people are more familiar with the fact that they can afford this and they can get out to the market and buy this great food. The other program that has been tremendously successful for us is called Senior Match. The coupons that are available through the Farmers Market Authority, the Senior Nutrition Farmers Market coupons for income-eligible seniors, they apply for them online. Strangely enough, they apply online and get a coupon worth about $36 that they can use at any farmer's market. We have started a program to match that coupon booklet. Once that coupon booklet is empty, they bring us the coupon booklet and we match it with Monopoly money. So I give them $36 to spend at the farmer's market. Not a lot, but still we hope to provide help. I ran out of the money we had budgeted for this in 2 market days. And one of the days was July 4th for us, which was a torrential rainstorm. And I had seniors around the corner waving their coupon booklets at me, wanting that match. And so that has been tremendously successful, and we hope to continue that. If you will notice, we are piggybacking on programs that are already established, which means as a very small nonprofit, we do not have to do intake. Because we are guaranteed that these are the most vulnerable, income-accessible folks that we're getting the food to, and I don't have to ask anybody any questions because they're holding in their hand what tells me they have already gone through that process. So that has made that much simpler for us. We have a mobile market bus that takes food. It's the Market on Wheels. It's a popsicle truck with fruits and vegetables. It's nothing snazzy, although it looks really cute. It's not refrigerated. It was the mobile library for a nonprofit in town, and they gave it to us for a good price. This goes to senior centers, senior living facilities, area schools. We have a lot of issue with transportation, and so when people cannot make it to the market on Saturdays, this provides them the opportunity. We offer the Double Bucks program off the bus. We provide cooking demonstrations and preparation tips, recipes, just like we do in the senior boxes and at the farmers market. We also have a chef apprentice program where we train unemployed or underemployed individuals in the neighborhood in culinary skills. This is great training for them, and we hope to get them jobs in the food system somewhere so that when they receive fresh fruits and vegetables from somewhere, from a food bank or from somewhere, they know how to cook it. But it also affords us other hands to do the other programs we do out of the diner. They help us prepare the diner meals. We run the summer feeding program, and they help us with those programs. It takes a lot of folks working together to make this happen. It is imperative to us that we have good community partners. As you saw in the slide about the church, we have been seen as a resource center, so many of these groups were already associated with us. But we rely on neighborhood associations, we rely on the health department. There is a health action partnership formed with the health department, the food bank, many other nonprofits, and we work many of our programs in cooperation with them when none of us could do it on our own, through area colleges and the Center for Aging at the University of Alabama in Birmingham. We require a lot of funding. We do receive some individual donations, and we work at some sustainability programs, but we rely on many good private and public funders to help us do the programs that we do. We focus on low-income populations, primarily children and adults, but we look to our consumers for all of our neighborhood residents, people who are on SNAP, seniors who are on the senior nutrition program. And we work to figure out how to get all those people working together, the consumers, the funders, our community folks, and working with the programs that we have mentioned, the Senior Market Basket Program, the Diner, meal delivery programs, which I'll talk about in a minute, and the senior lunch carryouts, which I'll share with you. One of the really exciting things that has happened in the last year or so with PEER is we are able to be a vehicle for other groups to utilize their programs. So we are not having to reinvent the wheel. I am not having to do the research that I don't know how to do, but schools and other organizations are coming in and using our food delivery system, our connection to farmers, our connection to fresh fruits and vegetables. One of the great examples is the University of Alabama at Birmingham Acute Care for Elders Unit partnered with us to do a delivery program to people who had just been released from the hospital or from rehab facilities to see if improved nutrition would reduce the risk of readmission. I didn't have to know any of that. I didn't have to do any of the research. I didn't have to do any of the measurement. I didn't have to know any of that stuff I didn't know. But we were able to be a part of that, and they were able to utilize a local nonprofit that was already in existence to do the work. So they didn't have to have a test kitchen recreate the work. So I encourage you that are researchers and in medical facilities, look for local institutions to help you with those type of programs. We also in the last few months have area large churches picking up meals for us for senior programs they are doing in various parts of town. So that helps our program by the money they provide, and they're getting healthier, heartier meals to provide to their seniors. So it's a great connection. We also, as a very small group, have to look at funding possibilities. We have annual fundraisers. We produce value-added products from the fruits and vegetables we purchase from the farmers, and we rely, as I said, a lot on grant writing. Our leadership is key. We have to ensure that we have quality staff. We rely on our community to let us know that we are meeting the needs that they have. We have a lot of need for volunteers and a lot of need for interns. We work closely with our area colleges to provide that, and we rely on a board to help us with marketing and fundraising. It takes all of us working together to get the job done. This is my contact information. I again appreciate the time that you have given me. Thank you.